Okay.
14 ayes, 0 nays.
Thank you, Mr. Chairman.
Thank you, Senator Donovan. Who is next? Senator McClellan. Thank you for being so patient.
Thank you. I have Senate Bill 907, and I have a substitute.
Okay, is there a motion on a substitute? Been moved and seconded the substitute be adopted. All those in favor say aye. And, okay. Any opposed? By a vote of 1-0, the substitute's adopted. Senator McClellan.
Thank you, Mr. Chair. Senate Bill 907 codifies the no copay contraceptive drug device and procedure coverage requirements of the Affordable Care Act into Virginia law, safeguarding these essential benefits for all Virginians, regardless of what happens with the Affordable Care Act in Washington. Since 2012, Virginians have reaped both economic and health benefits from the no copay comprehensive coverage of contraceptives defined by regulations as part of the mandated coverage of women's essential health services. And this would, again, codify these benefits in Virginia law so that whatever, there's a lot of uncertainty about what's going to happen with the Affordable Care Act, but this would enshrine these protections in Virginia law. By 2015, over 55 million women in America have used contraceptives and had coverage. And a 2015 Kaiser Family Foundation survey found that over 77% of women and 64% of men support laws requiring health insurance plans to cover the cost of birth control with no copay. A 2017 poll showed that over 77% of women do not want these benefits to stop. I think it's important to note that contraception is about more than just preventing unwanted pregnancies. I first started using contraception when I had recurring ovarian cysts, and the birth control pills were prescribed as treatment that basically made the pain stop and made those cysts go away. For some women, and I think of a patient in particular that my doctor told me about when I got pregnant for the first time, and we started discussing some of the, often overlooked portions of the debate on contraception. Is he had a patient who had a hole in her heart, who was married, who needed to be on birth control because if she got pregnant, she would die. There are, as you get older, and this is something that I'm about to have to make a decision on myself, the pill itself is not as effective, has other side effects that can endanger your life, and an IUD may be a better option for you, but an IUD is much more expensive. And so what no copay birth control does is take the cost of these preventative measures off the table, and you can make decisions based on what is right for you, not whether or not your insurance covers it or whether you can afford the copay. And with that, I am sure there are a number of people who want to testify on this bill.
Okay. Are there questions to the patron? Okay, let's hear from the proponents of the bill first. And you are on the clock, Senator McClellan.
Good afternoon. My name is Dr. Wendy Klein. I'm a physician whose lifelong career has been focused on improving the health of women. I'd like to ask, is there anybody on this committee who does not want to reduce unintended pregnancy? Anyone? Because here is your opportunity. We know that eliminating cost as a barrier to effective methods of contraception is associated with increased uptake of these methods, which in turn has been shown to contribute to reducing unintended pregnancy and abortion. We know that there are well-established negative health and socioeconomic outcomes associated with unplanned births, including delayed prenatal care and negative birth outcomes. We know that the ability to plan pregnancies allows women the time and resources to invest in education and participate more fully in the workforce, benefiting not only themselves and their families, but also society as a whole. Others may claim that providing no copay contraception coverage is somehow a religious infringement, but we know that there are existing broad religious exemptions mandated by law. This bill is simply good health policy and sound fiscal policy. If you allow copays to be imposed on birth control, you're creating an undeniable obstacle for women and one that impacts many thousands of women. As Senator McClellan pointed out, there are many reasons that contraceptive medications are used. I implore you to do the right thing for the women of the Commonwealth. Thank you.
Senator McClellan, you have 3.5 minutes.
Yep.
Yes, ma'am.
Good afternoon. My name is Terina Keene. I'm the Executive Director of NARAL Pro-Choice Virginia, and we are here to support SB 907 because this bill makes sense to protect access to no copay birth control for Virginia women, especially in light of the constant attacks and the threats that we are seeing that will roll back this extremely popular and important benefit from the federal level. This bill simply enshrines current federal law into state law. It does not ask health insurers to do anything that they are not already doing. It is merely a proactive measure that protects this benefit should the Affordable Care Act be dismantled. Furthermore, as represented here today in this room by all the women you see behind me, the women of Virginia overwhelmingly support this provision, and they voted to protect health care access, especially reproductive health care, this past November. Nearly 4 in 10 voters ranked health care as their top priority over any other issue. And nationally, despite party affiliation, the no copay birth control mandate is one of the most popular portions of the federal health care law. And we're also seeing women out marching in the streets around the Commonwealth and around the country. Access to contraception is a win-win issue for women, for families, for candidates running for office, and most importantly, it is good policy. Virginia women are also afraid of losing this important benefit. The fear is understandable because birth control pills can run anywhere between $160 to $600 annually, and IUDs and implants can cost anywhere between $500 and $1,000 upon initial insertion. These costs can be prohibitive for many women and families, and this could lead to an unplanned pregnancy, which could put even more financial and emotional stress on struggling families. That is why this is critical that you protect access to no copay birth control for Virginia women and families. Thank you so much, and we appreciate your support.
Thank you. Senator McClellan, you have a minute left.
Hi, my name is Jessie, and I'm a constituent in SD 12. Before the ACA, I found myself working a full-time job without benefits for the first time in my adult life. I was 26 and uninsured, and I'd been on birth control since I was 16 due to a diagnosis of PCOS. Without insurance, I couldn't afford the yearly doctor's visits to receive my birth control prescription, and also couldn't afford the special prescription I needed to be on for the controlling of my cysts, which was $50 a month even when I had insurance. Due to this, I ended up in the ER from pain associated with a large cyst that had formed on my left ovary, leaving me unable to stand, much less work at the time. With the addition of no-cost birth control to the ACA, I no longer have to worry about affording my birth control and ending up incapacitated from pain.
Thank you. Yes, sir.
Good afternoon. I will be speaking on behalf of Alejandra Pablos. Hello, my name is Alejandra Pablos, and I'm the field coordinator for the Virginia Latina Advocacy Network, and I'm here to support SB 907. I work with Latinas and Latinxes from the LGBTQ community daily in the Commonwealth. Every woman and person should have access to affordable birth control that is right for them, no matter where they live, where they work, or how much money they make. Every day I meet and work with young people who have to support themselves financially, usually because they come from mixed status families and working families. Young women want to be able to make decisions for themselves. They want to focus on higher paying jobs and education. They want quality health care to cover birth control because most of them do not even make $15 an hour. And having birth control at no cost will be a relief for many people from that financial burden. They will be able to take better care of themselves and make better informed decisions. I myself have struggled to afford birth control in my lifetime, and I am here to speak on behalf of women and women of color and people who want to choose when and if to start a family. Please support preventative reproductive health care at no cost so that all women, regardless of their economic status or race, can access basic health care. Thank you.
Thank you. Senator McClellan, I'm just going to ask you to let each of the proponents just introduce themselves
Thank you.
and tell us they support it. Yes, ma'am.
Hi, I'm Tanisha White, and I support SB 907.
Thank you so much.
Good afternoon. My name is Judith Shamir. I'm from Vienna, Virginia, and I support this bill.
Thank you so much. Yes, ma'am.
Hi, my name is Amanda Braun. On behalf of Autumn Clemis, Senate District 6, please vote yes.
Thank you so much.
Hi, my name is Monica Hutchinson from Henrico County, and I support this bill.
Thank you, Monica. Thank you. Yes, ma'am.
Mr. Chair and committee members, Jennifer Allen with Planned Parenthood Advocates of Virginia. We strongly support this bill and ask for your support. Thank you.
Jennifer. Yes, ma'am.
My name is Casey Chavez, and I'm from Fairfax, Virginia. Please support this bill.
Thank you so much.
I'm Beverly LaTolati from Prince William County, and I have a daughter who has for many years needed to take contraceptives, not for contraception, but for other health-related issues.
Thank you, Beverly. Thank you.
Rebecca Gottwald, Fairfax. I support 907.
Thank you. Yes, ma'am.
Good afternoon. I'm here on behalf of Brittany Shook of Charlottesville, who supports this bill.
Thank you. Yes, ma'am.
Hello, I'm here on behalf of Darlene Flucker from Virginia Beach, and she would like your support on this bill.
Thank you. Yes, ma'am.
Hello, I'm Michelle Wooten from Hampton, Virginia, and I support this bill.
Thank you.
Good afternoon. My name is Gail Dady. I'm here on behalf of the ACLU of Virginia, and we support this bill.
Thank you. Jennifer, thank you for that. Are there opponents to the legislation? Yes, sir.
Good afternoon, Mr. Chairman, members of the committee. Jeff Caruso with the Virginia Catholic Conference. On behalf of Virginia's Catholic bishops and their two dioceses, we oppose this mandated coverage of contraception and sterilization that's included in the bill. I'm also authorized to say that the Family Foundation opposes the bill, as well as St. Francis Home, which is a faith-based organization that serves the elderly in the Richmond area. This bill does not codify existing federal law. There is a very, very narrow religious exemption in the bill, but the vast majority of entities with religious and moral objections would not fall within this substitute's religious exemption, and that is why it does not conform to federal law. The federal law has a very broad religious and moral exemption that goes well beyond this. And in fact, it's the narrowness of the exemption in this bill that's led to a lot of federal litigation, and we have an expert witness that very briefly can explain that further to you.
Thank you. Yes, sir.
Mr. Chairman, members of the committee, my name is Kevin Walsh. I'm a Virginia lawyer, law professor at the University of Richmond, former law clerk to Justice Scalia. For this bill, I am speaking from 5 years of experience litigating this at the federal level on behalf of the Little Sisters of the Poor. I'm not here today on their behalf or on anyone's behalf, but I can tell you that if this law passes with this very narrow religious exemption, there will be clients because this violates your own very good Virginia religious freedom law. So that's number one, is this is going to replicate what's happened on the federal level, which is years of lawsuits that have not advanced to any particular interest. And at a second level, apart from the religious exemption, I saw that there's a number of supporters from Planned Parenthood. They, I'm sure, are familiar with the Guttmacher Institute, which was formerly affiliated with them. And a study that the Guttmacher Institute put out asked, the title is, Did Contraceptive Use Patterns Change After the Affordable Care Act? The conclusion is, our research finds no evidence the ACA was associated with changes or improvements in contraceptive use patterns. And so if you're not replicating at the federal level because the exemption is too narrow, it will lead to state lawsuits. And even if this whole thing gets implemented, it won't have the effect desired.
Thank you so much. Any questions? Okay. Yes, ma'am. Despite what the clock says, there's 2 minutes left, okay?
Thank you. Mr. Chairman, members of the committee, I'm Katherine Carney. I'm the benefits manager for the Catholic Diocese of Richmond. In my position, I oversee all the benefits for approximately 3,000 employees in 24 diocesan schools, 145 church parishes, and the central administration offices. Since the inception of our plans, health insurance plans, we have never included coverage for contraceptions, and we could never include this in our coverage. In the Catholic Church, contraceptive use is not consistent with longstanding church teaching. We do have other associated organizations with the Diocese of Richmond who cannot comply with this bill because they do not primarily hire or serve Catholics. Thank you for your time.
Thank you so much. Okay, there's 1 minute left. If anybody else, okay. Senator McClellan, would you like to wrap up?
Thank you. I think it was my intent to replicate the benefit as it is in the Affordable Care Act. If we need more work to make that clear, I'd be happy to do that, but I think we all know what's going to happen here today. But I thank you for hearing this important bill, and I just want to reiterate that not all birth control is used solely to prevent unwanted pregnancies. There are medical benefits of them, and particularly with IUDs and longer lasting forms of birth control. Sometimes the cost is cost prohibitive, and this bill is an effort to help with those.
Mr. Chairman,
Senator Sproul.
speaking to the bill,
Yep.
I'm hearing what both sides saying. First of all, it's from a religious point of view. I'm not Catholic. I mean, that's what they believe. That ain't what I believe. So I'm not Catholic. So I'm concerned about the health of a person. I'm concerned about we cry all the time as far as poor people having babies and you can't afford them. And so then what happens? They go on welfare. So you complain about that. So you don't want them on welfare, but you don't want to give some keep from having babies. Let the family decide. So I resent one religion's coming up here and saying what they are. I belong to St. Joe, the El Zion Church. So, I understand what you're saying, but I want to protect women for safe health as far as Sen McClellan saying up for she may have to change later on because she's getting a little bit older and want to protect that. Some take it because of other reasons, but mainly concerned about poor people who we are trying to say to them that don't have babies. And then if you come and where I was raised, I'm not poor now, but in the projects, and why these poor people keep having babies for babies? Why don't they do something? And then they have babies, and then you complain about their own welfare. Don't have it, but you're on welfare. What can we do? So I just think, though, you got to do something to make it safe. So we were saying, don't use no rocks and go to these other methods of having babies. They kill themselves. We were saying, make it safe. This is a safe way of doing it. Let the family decide. Don't let some religions decide on it. Let the family decide. So I'm hoping that, Jen, they're not going to support it, but I'm hoping that if you would do that, whenever we can look out for the safety of the family and the babies, whenever we can do that and stop playing politics and don't let the church decide. I'm a Methodist. I'm not Catholic.
Okay. Otherwise, Senator Newman.
Senator, a couple of things. One, we've worked together for a long time. As you know, I'm very much in favor of birth control, and as a matter of fact, I'm in favor of emergency birth control and some other things because they delay or eliminate ovulation, and that's about as pro-life as you get to be there. I think but that's not everyone's belief. My question, I guess, is that at least, except for the religious exemption, this is basically current law that you are codifying. Is that correct? Basically, right now, except for the religious part that there may be a diversion from federal law, basically, we wouldn't be plowing any new ground, no new benefit with this. It would be only the existing benefit and codifying in Virginia law. Is that correct?
Yes, that is my intention.
Well, Mr. Chairman.
Yes, Senator Newman.
So, I mean, I don't know if we do it here or do it upstairs, but, I mean, to me, if something changes, then it's the time that we should probably look at it. That's just my opinion. And in general, I think that we should I'm very much in favor of birth control. At that time, we could find the ones. There may be certain birth controls that maybe this couldn't apply to or members of this committee can't agree on, but for the most part, I imagine that most here are generally in favor of it. So, to me, I don't think we need to do this year, and then I think we could look at it another year, but if there's other thoughts, I can hear from the committee first before making a motion.
Are there other members who wish to comment? Okay. Well, the committee operates by motion.
Second.
It's been moved and seconded that the bill be reported. I do have a note that the motion would have to go to finance.
I'll do it here. Mr.
It's
Chairman.
been moved and seconded that the bill be reported and referred to Committee on Finance. Senator
Mr. Chairman,
Newman.
I think that my motion would be that a substitute motion that we carry the bill over for the year, and then we determine what happens with the ACA. Likely nothing, but if anything does happen to the ACA, we'll have the vehicle to address it then.
Okay, there's been a substitute motion to bill be carried over to next year. Is there a second? Okay, it's been moved and seconded that the bill be carried over to substitute motion. Clerk, open the rolls. Okay. Believe everyone's.
12 ayes, 1 nay.
Okay, that bill's been carried over.
I thank you for your
Senator
attention.
McClellan, any others? Okay.
No, thank
All
you.
right. Next, Senator McPike.
Thank you, Mr. Chairman. Senate Bill 663, I think we have